At Carmanis, we, as I mentioned earlier today, are one of the 40 National Cancer Institute Centers of Excellence. And as such, we do a very broad range of research into diagnosing, preventing, and treating cancers. Our asbestos work is part of what's called the National Center for Vermiculite and Asbestos-Related Cancers. We're very aggressive in a number of areas of research and treatment which could be considered fairly cutting edge. So I want to touch on some of this, what we're doing today, a new program that we've established with the ATSDR and Blue Cross Blue Shield of all people to identify and treat asbestos and environmental cancers. We published a paper about a year ago after our last presentation here where we looked at a woman in her early 50s who is the adult child of a taconite miner. Taconite is one of those asbestos minerals which is not asbestos. It just causes asbestosis and mesothelioma, but it's not asbestos yet. Her dad was a taconite miner. Taconite is used in the Upper Peninsula of Michigan for the manufacture of steel. It's now used, actually we're selling it to the Chinese for patching roads, and it's anticipated to be sold throughout the United States before too long to patch roads as well. We looked at this woman in her 50s, and she was having intractable pleural pain. You know, we all know about pleural pain in mesothelioma and the nature of intractable pleural pain, but nobody really has described, or had described before we did last year, why it happens. Now, these are CAT scans, and they're all comparing 2005 to 2008, with that turquoise area being a pleural plaque. This is one of the permutations of our radiology work. That's sort of a regular CAT scan with an additional program called a vitreous system added onto it that we run images through. And we actually, though this is just sort of a 2D projection and the size of the plaque does not look that much different, we actually calculate the volume of the plaque, and it's significantly increased. This is a right pleural plaque. This one's a little bit easier to see from 2005 to 2008. This is from the back. You see that sort of gray structure. At the bottom right is the liver. But you can see the pleural plaque grew. And the patient's pain increased significantly in that 3-year period of time as well. This is a left pleural plaque from the right. You can see, can everybody tell that just by eyeballing it, that the plaque is much bigger? Let me tell you, for those of you who have an interest either medically, academically, or professionally in the size of pleural plaques, you know, there's a lot of baloney over the years that's been said pleural plaques are the beauty mark of asbestos. You know, the Nazis used to say that actually. Or pleural plaques are the calling card of asbestos. And in many compensation schemes, they're just completely overlooked. Well, that really is senseless because this particular plaque did cause intractable pain, or does cause intractable pain. And you can see it getting bigger. And we anticipate this one growing large enough to impinge on the forced vital capacity, on the capacity of the lung. Maybe you can appreciate the difference in the thickness here. In the diaphragmatic plaque, again, it's a volume measurement. Our program measures the volume. Pericardial plaque, those of you who know about plaques know that they often manifest on the covering of the heart. So, the illustration here is that in our paper, we did ultimately discover that the plaques rub against the bone of the rib and causes the periosteum, the covering of the bone, to become frayed, and the actual bone itself undergoes erosion. So we discovered, and nobody's disputed us yet, on why pleural plaques cause pain. Now, one interesting factoid, this is one of the free association things, is that we found that in most of these patients, this is not our only patient, this was just one of the most unique to report because we were able to get a co-author from the EPA to help provide some gravitas to our theory. Most of these patients lose weight. So you can do a few different things for losing weight. You know, in the old days, we used to tell people, this is the really old days, give people a bottle of beer before dinner. But it really didn't do much good. It made you a little bit happier, but didn't put on much weight. We use a drug in oncology called Megase, some of you may have heard of. But what we ended up striking on is sort of an interesting use in these patients who are losing weight with intractable pain is Marinol. Marinol is oral marijuana, not the kind you smoke, but the kind you take in a pill. We discovered it because of the number of patients who were in their 70s who had spent their lives as sort of law-abiding citizens who were telling me that the only thing that took away their pain and made them hungry was to smoke marijuana. So we try and prescribe it for them in a legal form where the insurance allows. And it puts weight on. Puts weight on, takes away pain, induces well-being. It's really marvelous. Okay, now, one of the things that comes up often in the controversy of should you do x-rays every year, should you do CAT scans every year, is that there's an ignorance of the fact that when you're dealing with people with asbestos-related disease, you're dealing with a high-risk population. Not only is there an increased risk of lung cancer, and you do not, by the way, have to have asbestosis in order to have lung cancer. You just have to have asbestos exposure. Mesothelioma, there's an increased risk of colon cancers, of GI cancers, and laryngeal cancers. So this was a 66-year-of-age African-American steelworker with a 40-pack year history of cigarettes, COPD, asbestos, and coke oven emissions. Coke oven emissions, if you work at the top of a coke oven in a steel mill, it confers about a 500-fold increased risk of getting lung cancer. To put it in perspective, cigarette smoking causes about a 10-fold increased risk of lung cancer. Asbestos exposure alone causes a 5 to 9-fold increase, depending on who you read, increase in lung cancer. But cigarette smoking and asbestos exposure together cause a 54 to 90-fold increased risk in lung cancer. So if you put coke oven emissions on top of that, you're pretty lucky if you don't get lung cancer before the end of next week. That having been said, this was a patient we felt comfortable and obligated to perform CAT scans every year. He had a 8 to 9 millimeter nodule, which stayed stable for 9 years. And on year 10, the radiologist said, I think that grew by a millimeter. We PET scanned him, and you can see that black dot on the left. That was his 9-year, this is the radiologist yelling at me and the insurance company yelling at me that this nodule's not going to go anywhere, and we saved the man's life. For your knowledge, PET scans are not the greatest things since sliced bread either. They're very good, but 30% of PET scans miss cancers. So what did this sort of trigger for us at Karmanos? Well, we want to try and prevent these cancers where we can. And where we can't prevent them, we want to detect them early. Something I want to mention that Terry Lynch forgot to say, and he really should have, not only because of the credit for himself, but for the other people who do his work. For those of you who don't know, the most important single factor in the American workplace for the prevention of health violations is the presence of a union. The single most important factor, just having a union. Okay, so what we did earlier this year is we're trying to take a realistic, late last year, a realistic look at environmental cancers, arsenic, asbestos, and radon, which in Michigan are the 3 most common causes of lung cancers other than cigarette smoking. That, by the way, is the background slide, is one of our slides that we use. That area in the upper left under the Karmanos and toxic is a pleural plaque. It's again a different technique that we use, but one that helps you realize how useless bee reading is. It's based on our approach to identifying these asbestos cancers, these arsenic cancers, and these radon cancers are based on simple, basic public health considerations. And the prototypical example we used was that in the Rwandese refugee camp at Goma, Zaire, after the Rwandese civil war, about 7,000 people a day were dying. They had cholera, dysentery, measles, meningitis, and HIV. In the U.S. sector, however, the death rate was only 30% of the remainder of the camp. And the Americans did that by building toilets, pretty basic, and providing clear water. And in this case, this is me catching meningitis, which ultimately resulted in my neuropathy. But you'll notice I'm not wearing a mask. If I would have been wearing a respirator, I wouldn't have got meningitis. But within that context, if you look at the asbestos and non-tobacco related cancers, the important figure here is that 30% of lung cancers are associated with environmental factors, not including tobacco use and diet. Early detection is pretty important. 5-year survival rate is only 15%. In most lung cancer cases, 15% are asymptomatic at the diagnosis. Majority are diagnosed at late stages. Part of this is true in the asbestos population because we do x-rays and B readings. And I can tell you, for those of you who aren't familiar with the literature's unchanged. By the time you can see a cancer on an x-ray, it's probably too late. However, CAT scanning and CAT scanning and particularly in vitro 3D scanning is a different story. If you can detect a cancer during the asymptomatic stage, 5-year survival rate approaches 67%. That's pretty damn impressive. Think about the difference in those numbers. What kind of life is lost? Again, just a quick idea why early detection is so important in early aggressive treatment. Machinists lose 8 years, construction workers 5.7 years, managers lose 7.2 years. I took care of the manager of the Libby facility, the Libby processing facility in Dearborn. And what you see in clinical practice bears out what the epidemiology says. CDC reports malignant mesothelioma increasing 8.9%. I personally think, based on my experience, that meso deaths are often misdiagnosed. Dr. Kindler, I think, can speak to this better than I can. But I see an enormous level of misdiagnosis. I bet at least half the cases are missed. GI cancers, this is important. People have to get a colonoscopy. For some reason, this does not get said enough. There's a 200% increased risk of colon cancer in asbestos-exposed patients. You need a colonoscopy. The only reason why, I was on the American Thoracic Society committee that wrote the guidelines for diagnosing and treatment of asbestos diseases, and the major reason why we didn't include flexible laryngoscopy and esophagoduodenal EGDs, looking down the center, is because it's just not practical to do on a clinical basis. What we've done in Michigan is we've taken, those are areas where radon is. We've started an initiative. Radon accounts for 21,000 to 25,000 deaths in the United States per year from lung cancer. In Michigan, we have a very high arsenic population. This is, again, some of our approach to making a CAT scan of lungs. That's the lung with the bone stripped away in the heart. Kind of cool. What we've done with what we call the Environmental Cancer Initiative is the following. One of the ways that asbestos-related diseases and radon cancers and arsenic cancers get missed is because doctors don't know how to diagnose them. So we've started an incentive program with the ATSDR and with Blue Cross Blue Shield that allows us to pay doctors actually $500 for taking 4 one-hour courses online on how to diagnose the most common causes of environmental lung cancer. It seems to be working. We're having a gradual start. We just started after the first of the year, but it's gaining in popularity daily. And we also ask the physicians to ask 3 basic questions. Have you ever been exposed to asbestos? And then we have some sub-questions on how they may have had exposure. Do you live in an area where there's radon? And we show them the map of radon. And we ask questions then about arsenic. We have a big water table contamination in Michigan. So using the epidemiology, knowing that all 3 of these exposures separately cause lung cancer, if there's a concurrent or a combination experience, we expect the incidence of lung cancer to be crazy through the roof. So we watch the patients very closely. Something we've actually been doing clinically for nearly 12 years, and we know we save lives. And the idea is to teach other doctors some of the basics that you here today probably know much better than most of us were taught in medical school, but to learn the basics on how to diagnose, treat, and prevent cancers caused by asbestos and other environmental carcinogens.